Congratulations on your decision to have cataract surgery. This is an exciting time, and we're very confident that this will have a great improvement in the quality of your vision and the quality of your life. I'm actually here in the operating room where the cataract surgery is going to take place, and you can see throughout the room there's a lot of equipment, and this equipment is very high technology equipment that allows us to have excellent results with the surgery and provide the most successful opportunity that we can to get your vision to be the very best that we can. There are some decisions that the patient has to make in preparation for their cataract surgery. The first decision is the type of technology that we're going to use when we remove the cataract. We talked about a standard cataract, but also what's called laser cataract surgery. I'm actually sitting in front of the laser itself that we utilize when we perform that surgery. The benefit of the laser is able to do three things for us that a standard cataract surgery is not able to do. A laser treats astigmatism. Astigmatism is nothing bad, it's just the shape of your eyeball. But by treating astigmatism, it gives the patient a higher quality of vision without their glasses after surgery. The laser also softens up the cataract so that we're able to remove the cataract a little bit easier as we're performing the surgery. The benefit of this is that it usually results in a little less post-operative inflammation and helps in the healing process to be a little more speedy. And the final thing is the laser is very precise. The laser will be performing some of the incisions on the eye that normally we would do by hand, but with the laser performing them, it gives an excellent laser quality precision of incisions that is very repeatable as we do it. So those are the three big benefits of the laser technology as we do the surgery. The next question then, of course, is what type of a lens implant do I want to put in my eye? And this is where there are multiple options. All of them are very good, and they all relate to what type of quality of vision you would like to have with or without glasses. A standard cataract, we're going to be putting the lens in your eye. That lens is considered what we call monofocal. It has one focusing point. We can make that focusing point for up close if a patient would prefer to read without glasses, but then they would still need glasses for their distance vision. Or we can keep the focus point in the distance, and the patients often can do distance quite well without glasses, but they would then need glasses for reading. The other thing a monofocal lens does not correct for is astigmatism. And so if someone does have some astigmatism, they would still need glasses to correct their astigmatism, whether it be for reading or for distance. So with a monofocal lens, generally speaking, I would tell patients that your quality of vision is going to be a lot better because there's no more cataract, but you would still need glasses to focus for most things after the cataract surgery. Another type of lens you'll hear is called a toric lens, and a toric lens is a lens that corrects higher amounts of astigmatism. So if someone has a significant amount of astigmatism that sometimes the laser itself won't be able to correct on its own, a patient would need a toric lens, and the toric lens is able to treat the higher amounts of astigmatism. Before we do your cataract surgery, we will be doing very specific measurements that detect and tell me how much astigmatism is in your eye, and that allows us to have a more definitive decision as to whether or not a toric lens would be most beneficial. Another type of lens is what's called a multifocal lens. These are lenses that have the ability and capacity to focus on all the different aspects of vision, distance, intermediate, and up close, to try to mitigate the need for glasses as much as possible. The benefit of these lenses is their ability to be able to diminish that need for glasses. While I wish I could say all lenses were perfect in every aspect of vision, there are some limitations to these lenses, but generally speaking, patients do very well with them. The technology on these types of lenses uses rings on the lens implant itself. Occasionally at nighttime, patients can see an outline of those rings as they look at a headlight or a street light. Typically, this is just going to dissipate with time as the brain adjusts and gets used to it. Not everybody experiences it, but some patients will. The time frame by which they adjust to it will vary from person to person. These lenses also, when a person is reading, typically require good lighting to get the optimal vision without the need for glasses. So the better the lighting, the better the quality of vision will be in these multifocal lenses. We've been very pleased with the results of multifocal lenses, and patients have done very well and found a lot less dependence on glasses and all the different aspects of vision. Another type of lens, which is some very unique technology, is what we refer to as a light adjustable lens. Now, this is a lens that does give some distance in intermediate. When it comes to the reading, patients can often still need a little bit of reading glasses to help out. However, the unique part about this lens is we are able to customize the lens after the surgery. We can alter the prescription of the lens implant to tailor it to the patient's needs just by shining a light on it after surgery. That allows us to adjust what a person's prescription is to accommodate whatever their needs might be. This does not work via the ring technology, so we don't have to deal with any rings at nighttime, and that allows the patient to be able to see up close and often have less dependence on their need for reading glasses. It's truly some unique technology that allows us to really tailor-made the needs of the patient to what their vision needs are and what they would like to have as an outcome. All of these are excellent choices. There's not a wrong choice in any of them. The quality of vision is going to improve just removing the cataract. But now the choice is what type of a lens. And I will often tell patients, ask yourself the question is, how independent do you want to be of your glasses? And that will often guide and direct the decision we make as to the lens options that are available to you. It's a great surgery. Cataract surgery has the highest patient satisfaction rate of any surgery, and we're excited to be able to improve the quality of your vision and in the process, hopefully improve the quality of your life. Thank you.